So there are these models that have been created that show us a better way. And for example, in DC and New York City, two things just happened in December and January to improve existing paid sick days laws, because if we're pro-family, we should be pro-everybody's family, and that means we don't leave out tip workers and we don't leave out workers in smaller companies, and that's really exciting. In Newark, just passed today unanimously, and Jersey City and New York and Portland, the paid sick days law includes language that says if there's a public health emergency and schools are closed, like in Wisconsin today where it's too cold for kids to stand outside for the bus, then parents can stay home and use that time. I'll tell you, there are a lot of 8-year-olds watching 4-year-olds in Milwaukee today and lots of other places because they don't have that, because they took it away from us. And that's really important. So those kind of provisions. In the New Jersey bills, there's also provision of carving in direct care workers, people who have direct contact with the public, child care, food service, home health care, even if they're in the smaller business, that they'll get the larger number of days because of the importance for the public health. So those are some good models. We have some great federal legislation. I want to mention 3 bills. One was just introduced, the Family Act, which would create a social insurance fund. Employees and employers would each pay a very small amount of money, 0.2% of payroll, into that fund, and then there'd be enough that when you're sick, you could, or when you have a new child, or a serious illness, or a serious family member has an illness, you could use that time to draw up to 2/3 of your pay for up to 12 weeks. And you know, I have to say, I was on a bipartisan commission on leave in 1995, appointed by Congress to study the impact of the Family and Medical Leave Act. 6 people appointed because our organizations had worked to pass family leave, 6 appointed because they worked to stop it. Try to imagine what those meetings were like. And unanimously, that group, which almost agreed on nothing, unanimously agreed to encourage states to experiment with forms of wage replacement, because it was pretty clear from the research that we commissioned that people couldn't do it. We asked, how do you support yourself while you're on leave? 9%, today it's 10%, said by going on public assistance. And for the lowest fifth, 20% went on public assistance. How does that make sense as a society?